John Brennan, you've dealt with post 9/11, you've dealt with crises throughout your career in intelligence, real homeland security issues inside the White House and in the agency. This feels so very different.
It is very different. And when I was the Homeland Security Advisor for President Obama, 3 months into the administration, we had to deal with the H1N1 crisis. And this was a crisis that the virus was identified first inside the United States, not abroad. So we didn't have time to try to figure out how we should...
Refresh our viewers' memory about H1N1.
Well, it was identified first in April of '09, and then through the next year, too, because once it subsided over the summer, it came back in the fall and the winter. And there were about 60 million Americans that were affected by H1N1 virus, with about 12,000 deaths. It was different than the coronavirus right now in terms of its transmissibility, as well as which demographics were affected by the virus. H1N1 affected younger, healthier adults much more seriously than the older population. So one of the things that President Obama told us, he wanted to have the science, facts, and data drive administration policies and actions. And so we had to engage very comprehensively, as well as very aggressively, to make sure that there was going to be a cross-the-government effort in terms of the federal government. But one of the most complex things is making sure that the federal government is working with the state and local governments, as well as with the health industry and others. So Dr. Fauci was somebody that we relied on so heavily. And President Obama would get regular briefings on this, but he always deferred to the experts to guide the popular perception about what they should do and how serious that influenza pandemic was at that time.
And later on, President Obama had to deal with Ebola. So he really had two on his watch.
Right, and he had created then a pandemic office in the White House that has been taken down by the Trump administration. So one of the things I think we see the difference here is that Donald Trump, who throughout his entire life, he's looked at the world through a prism of how things affect his personal and financial, political fortunes. And I wonder whether he's psychologically capable to put the country's well-being first and to subordinate his own interests in trying to spin things in a manner that's not going to reflect badly on him. Politics need to be damned at this point. The health and safety of the American public is most important. Now, obviously, we want to make sure that our economy is going to be able to withstand this traumatic hit that it seems to be taking right now. But we want to make sure that there is going to be truth and honesty that's coming out from our public officials, certainly from the White House and from someone who purports to be President of the United States.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.